Let's continue our discussion on plantar fasciopathy. I'm Dr. Donald DeFabio. Maybe you saw my original video on plantar fasciitis 10 years ago, and it's number 2 on YouTube because it talked about lengthening the calves. It talked about instrument-assisted soft tissue mobilization. It talked about stretches. It talked about chiropractic adjustments for the ankles and feet. All that still works. But guess what? We get even better results now because we stack that treatment with shockwave therapy. Shockwave therapy is a pressure wave therapy. And what those pressure waves do is it stimulates something called substance P. And substance P depresses pain, just like caspation, hot, red hot peppers decreases pain. That's how shockwave therapy works to decrease pain. They block the substance P. But also what shockwave does, those pressure waves create cavitation bubbles within the tissues, within the cells. Little tiny bubbles that stimulate healing at the cellular level. Stimulates stem cells. That's right. So the shockwave treatment is not only for the plantar fascia, again, it's got to be the whole calf. So we'll hit the whole calf. Go down into the Achilles. Looking for those areas where it's tight but sore. And the soreness is usually about a 4 to 7 out of 10. Then we get into the plantar fascia itself. Hot spot. So we found a hot spot. Those hot spots should be about 4 to 7 out of 10. In through the calves, very thick muscle. I use a wide head, a 40 millimeter head. When I get down to the feet, then we go to a 15 millimeter head, where it can be a little more focused. The shock waves, the pressure waves are penetrating directly where we need it. So let's look at how that impacts the calf. But remember, when you do shock wave therapy, first session, you may notice a little bit, you may not, but after that, we gotta hit it hard enough to stimulate healing. Research has shown the amount of pressure waves is essential, it's important, so you have to be a little aggressive. So an aggressive shockwave treatment, again, means we find those little spots here, wherever, or in this case, right there, where it's a 4 to 7 out of 10 on the pain scale. We do about 3,000 hits. That was only 1,800. And then we're done. 5-10 minutes, 6 to 8 sessions, once a week. Shockwave therapy, plantar fasciopathy. That is the next way to fix it forever. I'm Dr. Donald DeFabio.